So a lot has changed since y'all got together at Cincinnati. That's for sure. I mean, I'm new. This is my first patient care conference. My name is Brett Kopelan. I'm executive director of DebRA. So with the exception of Jerry, who's here, DebRA's completely different. Everybody that you knew before is no longer, and we have all new people. And I really, really want to say a big, big thank you to the entire DebRA staff who really pulled some order out of some serious chaos to put together a great conference. So by the time this is all over, everyone, all the new DebRA people will be where I'm standing now, and they will have introduced themselves. Don't be shy, go up to them. We're all wearing our nice little name tags. But as the saying goes, the more things change, the more they stay the same. If you look around, you're going to see some old faces that you already know. You're going to see the same speakers, all right? You're going to see a lot of same attendees. You're going to see people that you already know because of Facebook, but you've never met, but now you know them. So it's a good time to interact and have some fun. But more important, you're going to see some people that you probably weren't expecting. So where's Katie? Is she here right now, or is she coming tomorrow? Okay, Katie's coming tomorrow. She had some serious surgery about 2 weeks ago, and the fact that she made it here, it's impressive. It's unbelievable. So clearly this conference means something and means enough to Katie to get here, and we don't take that very lightly. So we've been working hard to put together a good conference for everybody. So I hope you're going to learn a lot. We're going to get to see some old friends, make some new friends, and just have some fun. I want to say thank you to all our speakers. We do have an impressive array of speakers here the next couple of days, and there sure are a lot of EB conferences this year. And so I want to really say thank you, and just know that I appreciate the fact that you made this one a priority. I appreciate it. And I'm sure everybody else here does as well. Now, I'm looking forward to hearing everything that you have to say, and I know my wife Jackie, who's over there, is looking forward to seeing some of the speeches as well. We are probably not going to be able to see all the speeches. We have a 5-year-old who's going to be hanging out, and I'll probably be hanging out in the kids' room as well, because let's face it, I want to watch Kung Fu Panda on a 60-inch television screen. You know? But don't worry, if you can't see all of them, right, or if you choose to go have fun in the 3 kids' rooms that we have this year, we're videotaping. You'll be able to see everything on our website, on our new website that's going to launch pretty soon. I know it's another new website. We have a pretty dramatic change coming, and I think you're going to like it. There'll be more information on there, and it will certainly be more interactive. And now my iPad is acting up. Speaking of videotaping, you're going to notice that we've got 3 guys walking around. Sorry. Jason, Dante, and Nick. You guys here, you want to raise your hands real quick? You're in the back. All right, introduce yourselves, don't be shy. All right, and even sign up for some DebRA diaries. It's another thing that we're doing here that we're going to put up on the website. The goal for the video is we're going to be able to create advertisements, and we're going to go national on this. The idea is to be able to raise awareness and raise the funds for the foundational research and also the translational research. And we're going to fund some programs, expand on them, and maybe even introduce 1 or 2 new ones as time goes by. So don't be shy. They're here. We really want to get to a really good video together that's going to raise the funds that we need to stop this disease. You're also going to see that we have Christie's Inc. here. Where is she? Please raise your hand, Christy, in the back. She's going to be taking some photographs. She's going to ask you if you want. You can go up to her and say, I want some pictures taken. We have, an incredible area outside for everybody to take pictures for. Please don't hesitate. You know how good her work is from Facebook. So just go up, take some pictures. We'd love to see them. I want to say thank you to our sponsors. Clearly, without you guys, this conference does not exist. All right? Everybody should go up to the companies. They're here to talk to you. Don't just go up to the ones you already know. Go up to the ones that you don't know. It's a good idea to interact with them. This is the time to do it. You know what everyone else should do as well? you'll see right outside this room, we have something called the EB Care. It's the only patient-reported registry out there. DebRA International, DebRA US, and Lotus Tissue Repair came together to create this registry. And what we hope is that the data you'll provide will give us a better understanding of EB. It's going to let us advocate certainly a lot better. It's going to give more researchers the ability to go in and study different things. We're going to get a better hold of the cost of EB, the prevalence of EB, the burden of EB, and hopefully some people will actually apply to look at the anonymous data and do some research that's going to lead to new treatments and hopefully a cure. So if you need help doing that, James is outside. Hey James, raise your hand right there if you need help. I also want to say a thank you to those, one of the things that happened this year and last year, but much more this year, are people that go out and they throw local events. They go out and they raise awareness within their communities. And they've done a great job this year, they really have. I mean, you've got like, Love for Lucas thought they were going to raise $5,000, they ended up raising $30,000. I mean, that's amazing, right, for a first time. We've got Jogging for Jonah. Patrice is here. There she is. We've got Leslie's Butterfly Benefit, the Devani's Butterfly Wishes for Ellie. They've all been great. So what we're doing at DebRA is releasing more tools that are going to allow you to make your events bigger. I don't want to say better because that's not really possible, but just bigger. You've all seen what these personal fundraising pages can do. My wife and her friends made unbelievable use out of them recently, and they put together a run called Rafi's Run after my daughter, Rafaela, or Rafi, who is recessive dystrophic and sitting over there. They were able, by making use of the technology, they were able to raise more than $200,000 this year. 200 runners, more than 2,000 donations. That's the power of the social network. It's the power of email. It's the power of personal fundraising pages. And we're releasing more tools in the next couple of weeks to allow you to do something along those lines. If you need help, give us a call. Talk to Casey. Talk to Kelsey. Finally, well, I should say I'm really proud of her. She did a great job. Finally, I want to thank the Gaylord Palms. This is a pretty cool place, you know, and they've worked really hard at getting to understand EB and what our needs are. You can talk to them. They will be very helpful. Talk to us. Whatever you need, the Gaylord is completely and utterly willing. As you see, the first thing that they did was arranged a private meet and greet with some DreamWorks characters. I think it's tomorrow afternoon at 2. So make sure you show up. It's going to be in the same place that the registration was. Okay? So I'm looking forward to a great conference. And one last thing, before we start and I bring up some speakers. This is going to be the last patient care conference. All right, now I know that sounds a little strange, the last one, but we just need a better name, right? So we're going to hold a contest in the near future to come. We want you to come up with a good name, what it means to you. Because here, the next couple of days, we're not patients. None of us are, right? We're survivors. We're strong, we're brave, but more importantly, we're inspirational.